Have you ever donated blood or had someone in your family who has donated blood? Well, you have come to the right place because if you ever wondered how donated blood is screened for infections, we will be diving into this topic and gaining feedback later on in this video with expert Dr. Stephen Drews, an expert in microbiology and blood transfusion, and he is also in charge of microbiology at the Canadian Blood Services.
Hematology can be broken down into two parts, heme and ology. Heme comes from the Greek word for blood, and ology refers to the study of. So hematology refers to the study of blood. However, it does extend slightly more than that. Hematology is actually a branch of medicine which studies blood, blood-forming organs, as well as blood-related disorders and diseases. Blood tests can be used to detect and diagnose these diseases, such as hemophilia, leukemia, anemia, lymphomas, and several other infections. Hematologists are the individuals who diagnose and treat the wide ranges of diseases and disorders that are related to blood. Some of these diseases may cause individuals to bleed more heavily, whereas others keep your blood from flowing. These disorders can range from mild to life-threatening.
Next, let's review the components of blood. Blood can be separated into its distinct parts after being spun in a centrifuge in a process called blood fractionation. As you can see, it appears the blood has three main distinct components. The first layer is a clear yellow liquid called plasma. This is the liquid portion of blood that contains water, sugars, nutrients, vitamins, fats, waste products, and all the various proteins that your body needs to transport all around itself. It also helps maintain the body's fluid balance. The next layer is called the buffy coat. This layer contains white blood cells and platelets. As a refresher, white blood cells are involved in fighting harmful microorganisms, while platelets are there to clot blood and seal up tears when blood vessels are damaged. Lastly, the final layer and the most abundant layer is erythrocytes, which are red blood cells. These cells are responsible for transporting oxygen from the lungs to the rest of the body and carrying carbon dioxide back to the lungs to be expelled.
Next, we are going to be looking at the different types of blood. There are 4 different blood types that exist, which are type A, B, AB, or O blood. Blood group A has the A antigens on red blood cells with B antibodies in the plasma. Blood group B has B antigens on red blood cells with A antibodies in the plasma. Blood group AB has both A and B antigens on red blood cells, but no antibodies in the plasma. Finally, blood group O has no antigens on red blood cells, but has both A and B antibodies present in the plasma. Additionally, there is a Rh factor, which is a protein that can either be present or absent and determines whether your blood type is positive or negative. With the addition of this factor, there are 8 common blood types, which consist of A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, and O negative.
You are probably thinking, if I wanted to donate blood, how can I and who's able to? Well, according to the Canadian Blood Services, donors who are AB plus blood type are the universal recipients and can receive blood from anyone, whereas on the contrary, O negative blood types are the universal donors and can give blood to anyone. Taking a look at the American Society of Hematology chart, we can see that A plus recipients can receive blood from donors who are A plus, A minus, O plus, O negative. A minus blood type recipients can receive blood from A minus and O minus. B plus recipients can receive blood from donors who are B plus, B minus, O minus, and B minus recipients can receive donor blood from those who are B minus or O negative. Also, AB minus recipients can receive donor blood from donors who are AB minus, A minus, B minus, and O minus, and O plus recipients can receive blood from O positive and O negative, and O negative can receive blood from only those who are O negative. And as we were talking about earlier, AB positive recipients can receive blood from donors who are from any blood type. Now, you might be wondering, why is donating blood important? Well, according to the Mayo Clinic, this is a procedure that can help individuals replace lost blood either through a surgery that they've experienced or an illness. The blood contains components like red blood cells, white blood cells, plasma, and platelets. Red blood cells help carry oxygen and help remove waste products. The white blood cells are the soldiers of our body. They help to fight off infections. Platelets help to form a clot. Think of the time you had a cut on your hand. Platelets help to form the clot so there is no more bleeding from the site of the wound. We have been fortunate to learn more about this topic and share our findings with all of you through the guidance and time of Dr. Stephen Drews.
First, we are going to be looking at what are some infections that can be transferred from blood donations. First, prior to getting blood donated, donors are required to complete a health assessment questionnaire which asks a donor about their health, lifestyle, any medication they are taking, and any recent travel experience to help minimize the risk of transfusion-transmitted diseases. Some viral diseases that can be transmitted through blood include HIV-1, HIV-2, hepatitis B, hepatitis C, HTLV-1 and 2, and West Nile virus. Some bacterial diseases include syphilis and bacterial contamination, and parasitic diseases include Chagas disease.
So, what exactly is screened for in the blood? Prior to donations, donors are screened using a donor questionnaire, and then afterwards, their blood hemoglobin is tested. There are various kinds of tests that are used for bacterial, viral, and parasitic diseases. First off, antibody and antigen tests are used. Additionally, nucleic acid tests are used to identify if there are any genetic material of viruses within the blood. Finally, a bacterial culture is also conducted to screen out any bacterial contamination.
Now, you all might be wondering, how is donated blood stored? Donated blood is stored by having strict temperatures and appropriate conditions that preserve the quality and shelf life of the blood stored. It's important to remember that each component of the blood has a different refrigeration temperature and process that you'll see in the next slide. As indicated on the slide with the chart from the Canadian Blood Services, corresponding volumes, storage limits, storage temperatures, and pre transfusion preparation times are based according to red blood cells, buffy coat, derived pathogen and non pathogen reduced platelets, and different plasmas. Thank you so much for your time today, and we hope you all consider donating blood if you're able to. Until next time.